Nursing retention and recruitment strategies are essential activities to ensure the viability of healthcare delivery in Canada.
We weren't trying to suggest that there was a single initiative that would address all of the retention and recruitment. So we did. We created sort of a palette of opportunities or choices for people looking at trying to balance different age groups as well.
It enabled us to look at things that had been previously discussed or in existence, like the weekend worker or the transitional grad nurse program, as well as to sort of do the more creative ones that we sort of made up at the bargaining table in open discussions. And we knew when we finished it that we didn't have all the I's dotted and the T's crossed, but there was that willingness to give it a try and see if it worked.
I think ambitious and naive would...
Those things together, yes, absolutely.
The 7 initiatives evaluated included 1 entry into the workforce, called the Transitional Graduate Nurse Recruitment Program, 4 flexible work options, and 2 pre-retirement programs.
I found it very, very valuable to have the union, the employer, and a government workforce planner all at the same table speaking about the same issue from 3 different perspectives. I also found it very interesting because there was nothing at stake. It was a group of people coming together to work for a common purpose. And we had, if you like, a neutral third party to guide us through that process. So it became a very collegial learning experience. And I found that very, very valuable, that we actually sat down and we were looking at very specific pieces in the agreement and how did that actually make an impact on the system.
In the 60s, Marlene Kramer initiated something called reality shock. I think it just really resonated with people, this idea that you're hit with this reality as a young nurse and you don't know how to connect your theoretical and conceptual and perhaps ideological ideas of practice with the realities of fiscal management, resource allocation, staffing issues.
Because right now I feel like I'm going to have to change into a person I don't want to be to work within the system.
If I mold that experience and I provide the environment of support, stability, consistency, familiarity, and predictability, if I provide that kind of an environment, I know that grad's going to grow.
In the 8 weeks, we switched between 2 units, and the difference in unit culture between the two, it was like I was like, whoa, okay, it's not just about the type of patient that I want to work with, it's about where am I going to feel that I can work with the staff, and there's resources, and what is management saying, what's accepted on the unit, what isn't. We're so thirsty for knowledge and we just want to know and we just want to do it right and we just don't want to kill our patients.
The objective of the Transitional Graduate Nurse Recruitment Program is to support the transition from nursing student to practicing nurse.
ICU is where I wanted to be from the very beginning. I didn't have any doubts on that would be the place where I ended up, and it offered me the opportunity to get there from the very beginning.
It's done what I intended it to do, or what I had hoped it would do. It allows me to continue to work, and it allows me to be very involved with my children. I'm happier globally, so perhaps I'm happier at work.
I like the mix with my current position. Some paper, some clinical. I'm a charge nurse. I enjoy working with all the departments and coordinating, and I do some hands-on care. And working with the young new staff, I really enjoy that.
It helped me to transition basically by offering me further education in an area that I was interested in, introducing me right away into collaborative teamwork, partnerships, an advanced level of thinking in nursing, and it was very challenging at the same time coming in as a new grad. And this program actually offered an opportunity to have them shape and mold somebody from the beginning, and it helped me to open up a playing field where I could ask questions without feeling like I was intruding on anybody or that I was in the way. It was a huge learning curve, especially being fresh out of nursing school. But the educators at each of the sites put together a 2-month intensive course to help us get our systems aligned with where we needed to be to step into the ICU as a new nurse.
Nursing is very physically demanding. If it didn't exist, I'd probably be more tired, I think not as positive, and either perhaps retired or definitely reduced clinical or not working in an acute care situation.
Both parties were very interested in designing and defining how we could do that, how we could respect these people that were leaving the industry, give them an opportunity to share with the people coming into the industry all that they had learned. And it wasn't just about the meat and potatoes of how you do the work, but it was about all those underlying pieces that you learn around politics and systems and how to get along with people and how to resolve issues when you're alone. And I was really pleased to see that we came together as a group and found a way of being able to do that.
In a follow-up survey of some of the retention and recruitment initiatives, the following findings were notable: an increase in satisfaction with the nursing profession, an increase in satisfaction with hours of work, increase in work-life balance, a decline of negative impact of health, and a decline of work-related stress.
We did look at with the Joint Committee a formal evaluation, but later on, not at the very beginning of implementing the initiatives. And I think that was a mistake. We talked about they should be evaluated, but I think if we had actually set them up with evaluation prior to implementation and a way to follow them through, we probably would have been a lot more successful, because setting up the evaluation process actually provides structure to implementation.
And success can't just be on an individual basis, not an individual person, not an individual unit, but we need to look at the whole system's impact that occurs when you make such a transformation. And some of these initiatives have the opportunity to be totally transformative in the healthcare system, and it's a really good learning process beyond just nursing.
Talk to us, talk to the people that are implementing on the system, talk to the payroll people that are going to have to manage this. Make sure that we can administratively do some of these things. Again, I don't think the system should drive it, but if we're involved, sometimes it's just a matter of a small tweak to a word. Make sure you include worked hours versus, paid hours, those kind of things, because we always end up going back on what did they actually mean, and then actually put almost an implementation team together with almost a separate paper that would interpret the actual article. Defining a social return on investment is, this is the money we've invested by the different initiatives that we put into place, either the Becky's or the transitional grad nurse program or the early retirement opportunities. This is what it's costing us, but here's the benefits. We've contributed back to this system because a grad nurse, we've avoided having 3 nurses in one position because we've been able to retain a nurse. We've contributed to patient safety because, as we know, the less turnover there is in staff, the more confidence and competent nurses feel, then the higher your patient safety opportunities are within. The risk goes down. So there's all kinds of evaluations that we need to say beyond this was the cost and this is the benefit.
Recommendations from the evaluation include identifying initiatives that should be continued, providing a detailed implementation plan, using the evaluation findings to determine the next steps, identifying key indicators to measure success, ensure the engagement of stakeholders and the commitment of key decision makers, identify other related projects, use a project management approach and a joint communication strategy, and finally, a detailed evaluation plan which will include social return on investment. The relationship between the parties was key to the success of the evaluation and will provide a solid foundation for the future.
I think we understood that some of these options would function better in a larger unit where you had more employees. Some of them would be suitable to a small rural area.
We're incredibly fortunate that the research to action opportunity was presented to us, because we probably would not have had the level of evaluation that we're getting from this project. So the project and the resources, particularly from the federal government, has really made this possible for us, but has also, I think, provided a lot of credibility to our leap of faith.
The initiatives themselves. Yeah.
All of the objectives for the evaluation have been achieved, including the impact of the initiatives, the sites where they were implemented, the positive impact on quality of work-like indicators, and contributing to the national body of evidence-based research.
I would have a completely different outlook on nursing, and my skills would be completely different from where they are now.
They may not appeal to everybody, but they will appeal to somebody. Somebody will think that's a good fit for their life. And if you can keep one more person from maybe leaving the profession because the fit's not right, it can only be positive.
Made me more positive, more open to change, and keeping me abreast of policies and procedures and more accepting of them, and really enjoying interactions with the doctors, patients, learning. Every day I learn something, and I really enjoy the new grads. We've had some just awesome undergrads and new grads, and I learn from them as well.